My guest today is Nicole Rincon. Nicole is a board-certified physician assistant graduating from UC San Diego with honors in biology and special focus on microbiology and genetics. Nicole continued her healthcare education at Western University of Health Sciences, where she graduated on the Dean's List with a master's degree in physician assistant studies in 2007. Nicole is MAPS, Medical Academia of Pediatric Special Needs, attendee, and has extensive experience with pediatric special needs, integrative, and functional medicine. Currently, Nicole works at the Razignol Medical Center, which includes Dr. Dan Razignol and former guest Dr. Richard Fry. The Razignol Medical Center strives to identify what may be causing abnormal functioning of cells in persons with autism and other disorders using biomarkers that are objective, testable, and treatable. Through functional medicine intervention, Nicole saw a dramatic change in her family when addressing basic metabolic needs, gut health, and environmental changes. Her goal is to empower and educate her patients to actualize their ideal selves through medicine and natural remedies. Through Nicole's work at the Razignol Medical Center and her experience, she has vast information and knowledge about non-traditional treatments. For that reason, we plan on having several episodes to discuss Nicole's findings and share incredible insights to the public. And now, my conversation with Nicole Rincon. Nicole, let's start with your education and professional history, and then the path into autism specifically.
Perfect. Thanks, Ryan. I just want to thank you first, Ryan, before we even get started. I really appreciate you having me on the podcast, and I appreciate you reaching out. This is an honor to be here and to speak with you, and I'm really looking forward to it. So my experience, I have an interesting story. So I'm a physician assistant. I've been practicing medicine for 17 years now, I believe. And let's see, 2007. Yeah, 17 years. As a child, just to even go way back further than that, I was a pretty academic child. I was very good in math. I actually got a scholarship to college in math. So very, very left brain there. And I went to UC San Diego, and I loved biology. I love the study of science. So I got a bachelor's degree in biology, pretty good grades. I ended up going to PA school at Western University in Pomona. I was the youngest PA in my graduating class because I'm intense. I just blasted through the program, and I was on the Dean's List. So I've always enjoyed academics and being in that world. In the meantime, I got my, PA degree. I met my husband in PA school. We ended up moving to San Diego, and I ended up getting into the wellness field pretty early on. So I was doing a lot of just wellness coaching as far as vitamins, supplements, dietary changes was primarily the focus. So healthy diet. And then basically after a few years, we decided we were going to try and get pregnant. So my husband and I tried. And after a few years, we went to the doctor and tried a few of the medications, didn't work, went to a fertility specialist, and they ended up putting me on some follicle stimulating hormone. And we had, the first time we tried, I didn't get pregnant. Second time we tried, I got pregnant, which was wonderful. And then I had a miscarriage like 10 weeks later. And it was very, this period was super stressful for my husband and I. And we decided one more time, we're going to try one more time. So I ended up getting pregnant on the third and last. And they found out it was triplets, which was, super scary, but super amazing. And we ended up, I seen the pregnancy through. So I had some ups and downs with that. I had bed rest that I had to start, I think, at 10 weeks. But we made it to 34 weeks, gave birth to the kids. The kids were, I had 2 boys and a girl. They're now 12 years old. And they were developing normally, hitting all their milestones. I was on cloud 9. My life was great. I had my husband and my home and my 3 kids and my job. And then at about 18 months, I noticed my one son started with a tremor, interestingly, in the morning. And he was starting to stutter a little. And I thought, that's interesting. So we took him to the doctor, and he said, well, maybe he has autism. I don't know. They send us to the regional center. We were getting worked up. And then but it wasn't too severe, and we didn't know what to think of it. So about 6 months later, at the 2-year mark, in the summertime, my other son, and my daughter severely regressed. My son mostly regressed. My daughter, at the same time, started having seizures. So here I have these healthy triplets at 2 years old. They regressed, especially my son that regressed at 2. He started smearing feces all over the wall, absolutely no eye contact. He had at least 50 words, 2-word sentences, lost all speech. Just spinning in the corner of the room. I couldn't get him back. And my daughter, like I said, she started having seizures. And so I was just devastated at this time. And I really got hit hard. I had some depression, temporarily. I mean, I couldn't get out of bed. I had to take a little leave of absence from work. And then I did what most parents do at that time, or a lot of parents with kids on the spectrum. And I just dove into the research. I said, I'm tired of feeling sorry for myself. There's something going on, I went to the doctor. They said, well, your son, we don't know, but he's stimming now. So let's put him on risperidone. It's the only FDA approved drug. And, I'm like, but what's wrong with him? Why is this happening? And, we don't know. It's autism. It's a psychological disorder. And, I'm just, me being me, I just didn't accept it. So he said, no. Okay. So I went into the research, and I stayed up till 2 a.m. every morning and just looking at studies. What can I do? And so he was diagnosed. They gave him a diagnosis of apraxia. So I went on to Google apraxia on PubMed, and basically I read a study. I think it was a double-blind placebo-controlled study about fish oil and vitamin E and the combination helping apraxia. And it was a pretty big study for the time. So I thought, okay, let's try it. So I gave my son, who was still severely gone at that point from me, I gave him this fish oil, omega-3, vitamin E. And within, I swear, it was like a week, he calmed down. He stopped spinning. And he actually started making eye contact with me again. And it was only within a week. And I thought, holy cow, like, we are onto something. And I felt this huge rush of energy and like, okay, we can do this. Like, okay, so we're going to keep the vitamin E, and I just, keep the fish oil. And I kept going down this rabbit hole. We added things. I found a trial on N-acetylcysteine, and I bought the exact brand at the dose that they had recommended, because I'm a PA. I'm like, I'm going to do this clinically. And I go down the B12, the methyl B12, and I go down the multivitamin with the B vitamins. And so I start adding on these substacks myself, and I was seeing improvement. Now, it wasn't miraculous. My son still didn't have speech, but I realized that maybe there was a fungal component. And so I started treating them with grapefruit seed extract at the time, which is what I had. And I noticed that their repetitive behaviors went down. And so I thought, okay, I need help. This is great. I'm on the right track. And so I ended up going to the Medical Academy of Pediatric Special Needs conference. And so it's a conference that trains clinicians how to treat children with autism and neurodevelopmental disorders. And I was so bold. I walked right into the conference as my first time there. And I'm like, who's the guy in charge? Like, who's the man? Like, who's the director? And they're like, oh, that's Dr. Rosignol. I said, great. Where is he? Does anyone know who he is? I don't even know what he looks like. And they're like, he's over there. So I just stomp up to him on the lunch break. I'm like, hey, I'm Nicole Rincon. I'm a physician assistant. I'd like to work with you. Can you hire me? And he looked at me and kind of laughed. And he's like, well, do you have a license to practice in California? I said, yeah. He said, okay. Yeah. Send me your resume. Sure. And then that was it. The interview process was over. And so he hired me, and obviously we communicated more, but I started working for him 2 weeks after that. I ended up putting in my resignation at my old job. I quit. So I was all in. I was going to do autism research, autism treatments, help my kids, help other kids. been great. So that kind of starts my story at Rosignol Medical Center. That was 8 years ago. And so, from there, Dr. Rosignol's helped me with my own kids. We've done, all the things, well, not all, but almost all the things I've recommended to my patients. We've tried. We are in this. I'm a mother. Both of my boys had a moderate to severe diagnosis of autism. At this point, now that they're 12, my son is one son, the severe son, ironically, has lost his diagnosis. And then my other son is very mild. And we still have issues. We have some OCD and still some repetitive and social stuff going on, but they're now in general education in 7th grade. They're getting A's and B's. There are no behavioral issues. I'm very proud of them. And I'm very blessed. I'm very grateful. And I'm proud of myself because, my husband has been so wonderful too. He supported me through this whole process. And so it was really a team effort to really dedicate our lives to change the trajectory of our kids' future. So the reason I'm here, the short of it is, for my long-winded intro, is that I feel grateful, I feel inspired, and I really want to help other families to know that there are things we can treat, that this is not just a psychological disorder that they were born with, that there's nothing you can do. I don't believe that. I think there's a lot of hope. I think there's a lot of changes. I think that certain things we may not be able to change, and you can't necessarily predict the trajectory of every child, but there's so much you can do. And so I'm just here to give parents hope and to hopefully, talk more with you about various treatments that they can do, things they can look at, things they can talk to their doctor about that really can, like I said, change their future in a positive way. Because the brains only get so long to grow. And obviously the brain there's neuroplasticity. It can change at any age, even at old age. But, there are critical windows that really help. So if you get to them early, there's critical windows. It really helps. It makes it easier. Children typically respond better the younger they are. So it's important not to wait. If you're on the fence about it, just try something, just start something, and obviously get help. And I do want a disclaimer too, that what I'm about to tell you and in future podcasts is not to be taken as direct medical advice. So please talk to your doctor about any of these interventions. I'm not your personal clinician. So please understand it's not to be implemented directly from me, but there are suggestions that maybe you can look at.
Yeah. For the listener, PubMed, Nicole reference, is an excellent resource for everything that really in medicine. And I've talked about PubMed quite a bit, so maybe the listener is aware of it. So I have, tell me about how you discovered the omega.
So again, if you look at PubMed, there's actually, out of supplements, it's one of the most studied supplements with double-blind placebo-controlled trials in autism. So there's a decent amount of literature. I can't remember the amount of studies. We're currently writing a paper on supplements and placebo-controlled substances. We're doing a review paper, Dr. Rosignol and I. So I'm trying to, I think it was maybe 12, but I'm guesstimating here. So, the most studied supplements they have, I believe, currently for placebo-controlled trials are omegas, melatonin, and vitamin D, I believe. But there's a lot of randomized controlled trials for different supplements as well. But yeah, I just did a PubMed search and looked and saw, what could be helpful. And there was an article, I could pull it up for our next podcast, but it specifically addresses apraxia in autism with omega-3s.
Okay. Yeah. Why I'm so curious about that is I've learned that omega and these things like EPA, DHA are they're like fiber optic cables to transfer electrons, and electrons are so critical for our biology, and I think maybe confusing and underrated, or at least a lot of people don't know about them.
Yeah.
What is known about regression?
Um, so that's a big topic, and that I could probably talk for about a half an hour on it. But there's varying literature. Dr. Fry and me as the second author, and also Dr. Rosganall wrote a study published actually earlier this year, correlating mitochondrial dysfunction with regression.
Okay.
So they find that especially mitochondrial respiration has been associated with it in certain kids. There's also some trials that show that there's regression found with seizures in kids and with epileptiform discharges. So, seizures are, again, another topic, but a lot of
Hmm.
kids have comorbid seizure disorder with autism.
Yeah, yeah,
And then there's also a subset of kids that don't actually have seizure disorder, but they have epileptiform discharges. And they're typically seen at night when the child is sleeping. So for every kid, you want to get a 24-hour EEG or an overnight EEG. And even if you're not seeing seizures, you can often see these spikes in various areas of the brain that aren't normal. I mean, they're not physiologic. They're not supposed to be there. And so these can correlate with actually autism behaviors and functioning. And they're found, and actually we're writing another paper on this, that this may be associated with a regression as well. So seizures, epileptiform discharges, possibly correlating. Now, that could have a mitochondrial dysfunction component to it. So they may all be related. And there's also some talk about, parents with, vaccinations. There's a lot of literature that's very mixed on the topic. So what they found is that, at least from the studies I've found, is that febrile regression specifically. So if a child has a fever, that can be associated with regression after post-vaccination. But like I said, the literature, there's a lot of studies with MMR specifically, and the thimerosal adjuvant, the kind of the mercury component of it.
hmm
And there's a lot of literature that says it's not associated with autism or regression. Anecdotally, I mean, I hear a lot of patients, or not a lot, I would say there's a subset of patients that say that. And they come to me and they said, yeah, they had their second year vaccines or their 18-month. And then a few days later, they lost speech. So
Yeah.
it's hard to know what to make of that. I think that the literature is mixed. And I think you and I have talked privately about this, is that I think there may be a component for vaccinations. I'm just going to say it because it's the controversial topic. But I
Yeah,
think,
yeah, yeah. Go ahead.
I mean, I hate putting it out there, but also, I mean, I think there may be a component to vaccinations and autism, especially with the aluminum adjuvant that's recently been added. There are a lot of studies that correlate autism with metal toxicity. And so
Hmm.
there's a study that was published in 2014, and it was looking at environmental trends, looking at, well, we know the incidence of autism has risen exponentially since the 90s, basically late 80s, mid 90s. So the author looked at what toxicants, what environmental exposures are we having that have been increasing commensurate with the rate of increasing autism. And the author postulated that it was the aluminum adjuvants in the vaccines that have been increasing, that correlated with the curve of autism. And they also correlated glyphosate, which is Roundup, and that's a brand name Roundup, but it's glyphosate that they put in to the foods, and specifically a lot of the seed oils, wrapping it back around to your omega-3 fatty acids. So a lot of these children, when they study them, they've found that many kids on the spectrum are deficient in omega-3s, and specifically DHA, that are found in fish oil. And a lot of these kids have an overburden of omega-6. So if you look at the glyphosate, I bring it around because, our diet is mostly composed of these omega-6 fatty acids and these seed oils, which may be inflammatory in and of itself. But then when you combine Roundup, glyphosate, which is a very potent antibiotic in its own sense. So when you study the toxic effects of glyphosate, you find that it actually selectively reduces lactobacillus in the gut, and it increases Clostridia species. And we see that exact profile in a lot of children with autism. We see that there's lack of bifido, lack of lactobacillus, and a lot of them have, C. difficile, a lot of them. And so you know, this is a profile that can be very severe in these kids. And then it skews propionic acid, and basically causes autistic behaviors, even in mouse models. This is how they induce autism in mouse models, is that they give them propionic acid, which is a Clostridia byproduct. So we kind of can correlate that these gut changes are increasing behavioral changes, and that can be correlated with the glyphosate. Now, it's all speculation, and this is where, but this is where some of the literature is going, and people are looking at this. So anyway, the full circle of regression is that I think there's multifactorial issues here. And I don't think it does the service to the autism community and the medical community at large to give a simple answer, to say, oh, it's the vaccines, or it's Roundup, or it's, when autism first came out, they used to blame, like, they called it refrigerator mothers, it's like, oh, it's the mother's fault. They weren't loving enough with their children. I mean, it's really folly to blame one specific thing when we can test it and see that there are metabolic issues, there are microbiome issues, there are mitochondrial issues, there are inflammation issues, lack of key fatty acids and vitamins and minerals. And so any of this is, fairly simply corrected as well. So that's why I'm here.
With you dialing in specific supplementations and kind of correcting each one of those kind of items that you mentioned, I think most of them, or a lot of them, were tied to the GI, gastrointestinal. So your history and your experience even gives you insight and information on this specific treatment.
Yes.
What is it like working at Raskinoff Medical Center, and how does it kind of set apart from other interventions?
That's a great question. Yeah, I really love it. Again, I met Dr. Rossignol. I'm working with him over the last 8 years. And, we consider ourselves kind of a functional medicine, integrative medicine clinic. And what that means is that instead of just treating a symptom or looking at one part of the body, so for example, autism is typically it's a DSM, it's a psych diagnosis, right? So it's a psychologic diagnosis. And so what we know that just if we were to just treat them with psychologic meds, risperidone, anti-dopamine or pro-serotonin or whatever, it really doesn't address any core symptoms, in the sense that these kids, it may reduce behaviors and maybe the scores will improve, but they're not, their metabolic profile doesn't change. They're not actually improving their function of their cells, the function of their metabolism, the function of their mitochondria. So that's where functional medicine comes into, is how are these things functioning in the body and how can we optimize that? Because if you fix the core problems with the, the immune system and the, all these, like the microbiome, the mitochondria, then the kids actually get better without even, without having to address the neurotransmitters, because you're fixing the underlying root cause. So that's kind of the premise of our practice. I love practicing this way. It's very holistic in looking at all the body systems and how, like you said, how the gut or the diet interferes with the brain, interferes with the mitochondria, interferes with neurotransmitters. And so you get to really play, you get to put on your scientific doctor hat, and really every visit is different. When I see each patient, every visit is tailored. When I see a patient, we don't have like a protocol, like, oh, this is what we do and this is how you do it. No, I mean, really it's tailored to every kid's needs. What are the symptoms we're seeing? Autism is a very, heterogeneous disease. It's very varied. It's very different in how it presents for every child or adult. And so we really have to target individual systems. And so I can talk about that process, Ryan, if you wanted to, a little more in depth.
First, I just have a comment that like these supplements that you're providing, instead of, and I'm glad that you brought up the psychological drugs as an alternative, because the supplements are upstream of like what synthesizes proteins that make the neurotransmitters. So instead of blocking them or manipulating them at like the synaptic level or the vesicle level or the uptake, etc., you're helping them create the proteins and these neuromodulators, neurotransmitters in, in a more organic way, in a more functional way.
Yes. So, for example, and yes, absolutely. So, for example, I wanted to bring this up because I think one of the biggest things that we can do to help kids right now with autism is folate. And, there's different forms of folate. But kids on this autism spectrum typically have problems with methylation. And methylation is part of a folate cycle. And it helps produce neurotransmitters specifically. And so, if kids have, you mentioned in talking previously with me, MTHFR deficits, they say that, most kids have at least 25 to 50% deficits if you're on the autism spectrum. I rarely see, and I do see them sometimes, but I rarely see a kid that does not have an MTHFR mutation with autism. So that means that they're not methylating folate properly. And without this folate methylation, they're not going to properly produce appropriate neurotransmitters and also detoxification like glutathione. A lot of these things that are really important for neurodevelopment at a critical age. And there's also something called folate receptor antibodies that up to 80%, 70 to 80%, depending on the trial you look at, of kids on the autism spectrum have positive folate receptor antibodies. And so what that means is that their body's blocking. There's two different kinds of antibodies, but in either case, their body is blocking folate from getting into the brain, active folate from getting into the brain. So what we find is that most kids have these antibodies and they're responding positively. The trials are really good as far as treating core symptoms of autism when giving them high dose folate. And it's just folinic acid. So it's not folic acid is synthetically made. Folinic acid is just the unmethylated portion that the body can take up and then cross the blood-brain barrier to help treat what we call cerebral folate deficiency. So maybe a lot of the core symptoms of autism, at least in part, are cerebral folate deficiency. So one supplement at a high dose to treat that, and also to treat the methylation in different combinations. Is it methylated? Is it not? How much do we give of each? But just that one simple supplement can really change, like you said, the downstream effect of how we make neurotransmitters, how we detoxify our body. And so we're really treating a root cause that will then in turn help the mitochondria, help the neurotransmitters, help the gut function, help your metabolism, help all these immune function. So it's really awesome to start at the root of the tree, as if you will.
Yeah. From my understanding is this methylation process. It's circular, and
Yes.
it's also dependent on methionine, an amino acid, a very special one. This is where all protein synthesis and DNA sequencing, I should say, start.
Yeah.
And it's kind of like these two circular things on a bicycle.
Mm-hmm.
And I envision it as a bicycle whereby if one's not running in the circular fashion, then the other process is going to be off.
Yes. And the byproduct of on the downstream of that bicycle, the bottom of that bicycle wheel, if you look at the diagrams, is often, like I said, cysteine and the glutathione as well. So you're getting this, and there's more. It's more complicated than this, but just for simplicity's sake, you're interfering with the neurotransmitter, the methionine portion of it, and you're also really impairing the glutathione component of it, which is the body's master antioxidant. It's the master, grabber of toxins, if you will. And these kids typically are low in glutathione, and likely, as a result of, they typically have a cysteine deficiency as well. So I will often give some N-acetylcysteine or some kind of sulfur support. But, in essence, if you optimize these few cycles, if you optimize the folic acid cycle, you optimize the Krebs cycle, which is the citric acid cycle, optimize the electron transport chain for mitochondrial functioning. Once you kind of look at these core things that are really driving the cell for energy production and and health and protection, then things just get better. So, and again, every kid is varied, and we do know that there are also some DNA changes that we have seen, particularly with mitochondrial DNA. So there are a lot of mitochondrial DNA, increased copy number variants, basically some duplicates, and there's things that we've seen that can change, but it doesn't. It's not. It's kind of a subset of autism, and I don't think that it certainly represents the majority. Yeah. So there are multiple things to look at.
What I'm hearing and learning about the approach here is you're starting at the very upstream process, the very start of the process, that if this is abnormal, all of these downstream processes are going to be off. And this explains why there are so many autism and XYZ, autism and dyspraxia, autism and allergies, eczema, the GI problems. This is all getting to the bottom of what people need to know. We need to go upstream and not at this downstream levels. It's not helping.
Absolutely. And one study, I believe, I think it was from the CDC or some kind of a health NIH maybe guideline, was saying that the average child diagnosed with autism has 4 comorbidities on average, in addition to the autism diagnosis. So they have functional constipation and ADHD and, allergic rhinitis and eczema, whatever, so there's it's not just a neurologic disorder. And we see that. And
I think that's why a lot of research now is coming out about the risk of developing Alzheimer's and Parkinson's, because all of these downstream or these upstream processes that's responsible for cell development and the nervous system development is already kind of off. So they're more susceptible to those aging problems.
Yes. Yeah, I have a family history of Parkinson's, and then I have my children with autism. I have a sibling with Guillain-Barré. And so looking around, I'm like, there's probably some underlying related thing, even though they're different presentations. And, it's very odd because previous to this, we didn't have any history of this, like, previous to my parents' generation.
Yeah.
It's not like this was a thing in my family for 7 generations, So it's just odd that we're kind of looking at this. And I think in my family's case, I think a lot of it, the cornerstone is mitochondrial dysfunction. And I think that's why, my kids regressed. There were several things going on at the time when my kids regressed that I can kind of point to. But I don't know if you want me to share my family story, but just personally, I know that my kids had a copper dominance, and we see this a lot in autism. So there's a very skewed increased copper to low zinc ratio, and they're supposed to be at a fairly similar ratio in neurotypical individuals. So copper dominance is one of the number one findings that they find with metalopathies in kids on the spectrum. So my kid's hair was red. Looking back, my daughter and my son, they were redheads. Copper redheads. And I remember thinking, my husband and I would talk about this, why are they red? Isn't that cute? We're not, because my husband's Hispanic. He's got black hair. I'm half Italian, and I have brown hair. And so we're like, whoa, look at how cute our kids were redheaded. And now looking back, they were probably severely copper dominant, because when I started testing them, they were really zinc deficient. And so that probably set the tone. And then, at the time as well, we had, just to wrap this around, I thought it was interesting that my kids all regressed at the same time. And I thought, well, there has to be something environmental. And I was young, and I wasn't in the space yet. And I didn't realize we had a water leak in my bathroom downstairs. And we kind of let it sit there for a while. The back of the bathtub wall was getting a little squishy, and we thought, okay, let's bring somebody out. And we brought out a plumber, and they opened up the whole wall. And I'm sure that there was just a ton of black mold back there, because it was right around that time when we opened up the wall, and we didn't properly remediate it. We didn't wall anything off or move out while they're doing it. And it was around that time that our kids got really sick. And I thought, I bet it was a huge dose of mold exposure on top of everything else that was going on. And it was part of it too. And And I noticed, like I was telling you, they had a big fungal overgrowth at that point that I had to kind of treat. And so once we properly remediated it, symptoms did get a little better. But it wasn't actually, ironically, it wasn't really till we moved out of that home 2 years later that my son started speaking again. Now, I don't know if it was moving out of the home or all of the interventions, because we were doing a lot at that time
Yeah.
with Rosignol that really brought his speech back. But there's a lot to look at, and there's a lot environmentally. I think a lot of these things play a part. So
Yeah. Things like Alzheimer's was 1910 whenever it hit medical literature.
mm-hmm.
Autism, 1943 for Canner. Like,
Mm-hmm.
you're right. All of these things just appeared,
Mm-hmm.
which is very interesting.
Mm-hmm.
What is it like working alongside Raznal and Richard Fry, and how that accelerates your ability to learn?
Yeah, it's amazing. I mean, these guys are really smart, and I'm always trying to pry information from them.
Yeah.
They're ironically, for as much as prolific as they are writing papers, they're kind of short-winded with conversation. So, and I'm like the chatter in the group, so I'm always trying to pry info from them. But yeah, they're very intelligent, and like I said, when it comes to explaining mitochondrial function and things, I mean, and cell biology, and these are the guys to talk to. I mean, I have a basic understanding of the function, but I'm more, I do all of the research. Well, not all of it, but I do a lot of the research. So I'm the one that's kind of scouring the trials, reading them, aggregating the data for them, presenting it to them, and they usually do the write-ups and kind of the finishing touches. But I learn something new every day. I mean, I'm doing, autism research, and my husband gets tired of hearing about it, because I'm just like, did you know this? And this, that. It's just so fascinating. There's so much out there to learn. So it's a fantastic opportunity. I do part-time research for Roscoe Medical Center, and then I see patients part-time as well.
Yeah. As a PA, having that insight to the research is a very, it's different. A lot of PAs, to my understanding, you don't see a lot of PAs on papers in like Nature or Neurobiology of Disease and all of these wonderful journals.
Yeah. Well, PAs, their structure, I mean, their function in the modern medical world is really to be a clinician, is to see patients, to help ease, I think, some of the healthcare burden that, we have. There's not, the number of clinicians or physicians is going down. So, I mean, I think their primary role is to see patients. And I think a lot of PAs are very well-intentioned. I mean, I love my colleagues. I've went to school with some really good-hearted people. I find that they're very down to earth. And they really just want to help people. I'm a little bit different in that, I've always been kind of a nerd at heart. And I really like the study of science. And I just find it fascinating, in addition to my like personal interest because of my family. But, I think most PAs are well-intentioned. They just don't go through the training, maybe because of lack of time. And I think it's mostly because employers don't encourage this. The modern medical model is not following this functional medicine model. And I think that because we are, we're just a niche private practice, we're not part of Kaiser or some of these other, Blue Cross or these other conglomerates. We're just here to practice medicine the way we want to. But most PAs are controlled by protocols. They're, if you have a, headache, then we're going to do this or that. And then we're going to give them this med. And they're not looking at, well, why do they have a headache? Is it a histamine intolerance? Is it a food allergy? Is there something else? What's the trigger? And that's just not how PA school is taught. And I think it's really just this disease, drug. And, and a lot of these things are very topical, and some of these things are effective. I mean, we prescribe meds, we do. Mm-hmm. And I think that there is a place for medications. I'm grateful I'm a PA. But really, what is the medication doing and why, and how could it be treating a core symptom? Or, how can we assist in the functioning of this person while we're treating the core symptoms? Because sometimes, it'll take, it took my kid like almost 10 years to lose his diagnosis, 8 years. So, I mean, what can we do in the meantime to help him function while we're help
Yeah.
detoxing his body and helping his, his metabolism and things like that. So, um, there's a place for that. But yes, the medical model teaches in a way that does not know how to approach autism. And I think that when we specifically, when I'm here telling everybody, like, there is a way to approach autism that is very medical and that is also very critical thinking, and that it is not just a psychological diagnosis. And we can see this in the body of literature that is vast. And so, I think it takes, a lot of curiosity and time in employers like Dr. Rosignol and Dr. Fry that are willing to, pay me to do research because, I have a family, I have to make money. But I want to do this research. I want to do the hard work. I want to figure it out, And so it's nice to have people that are out there supporting this community that are like, yes, let's all pool in together. We'll all figure this out. We're in this for the betterment of humanity, for the betterment of our kids. Because I believe that, we all have, a God-given right to health. I think that, I believe this. Like, I don't think that we should be sick, and that, our water or food or these systems, should be just putting Band-Aids on things. I want to see everybody well, and I'm going to do whatever I can to that end,
I'm
for
not
the
a
rest
big
of my life.
fan.
So
Yeah. I'm not a big fan of the medical paradigm with that prescription first approach and not finding root cause, like your practice and Resident Medical Center.
Yeah.
It's just the way it ought to be. And you said two things there that really captured me, because I say this quite a bit, but it's not relevant. But you said critical thinking and curiosity. That's the master combo if you really want to learn.
Well, this is the scientific method. I mean, this is what science used to be. This is what I love about science, because I'm very analytically minded. And so I like math, I like science, but I like the curiosity I like the thought experiments of, well, what if it's this? Or what if it's this driving this and not driving that? Okay, what are the studies about that? Oh, okay, somebody's done that. Maybe we should do a study on this. Or, it's really that curiosity combined with just, where are we at? Whose shoulders, what giants' shoulders can we stand on to really elevate our level of knowledge and, of course, apply that in a way that is meaningful, that people are meaningfully gaining skills and gaining health and gaining longevity. And it's
expanding the edges.
Expanding like you say, expanding the edges. Yeah, let's keep expanding those edges, And I love science. I think it's fabulous. I couldn't imagine me. I was so bored in high school. Oh, history was such a drag for me. I was like, this is not my thing. And my son is the same way. He just hates it. And I'm like, honey, we got to do it. I get it, and he struggles in school because he's very science focused too. So it's just an analytic mind. It's a beautiful thing when you can apply it towards something meaningful. Like I think you're doing, I'm doing. Let's spread the word. Let's do, let's talk about it. Let's talk about what is happening.
You've definitely taught me to take a step back whenever I see a physician assistant, to maybe not all of them are prescription first approaches. And you even said that they're often, that's the protocol that they have to follow, which is, it's
that's unfortunately the world that we're in. I mean, if I don't follow certain protocols in a primary care practice, I can be, sued, or I can be brought to the medical board for negligence. Oh, you didn't prescribe this statin for this person with high cholesterol. And it's like, well, you can tell them, I think this, I think that, perhaps they have mitochondrial dysfunction symptoms and I don't think it's appropriate, and all these things,
right, because statins implicate ubiquinol in mitochondria.
Exactly.
People should know that.
And so, exactly. And so, if I were to put somebody on a statin, I'd probably throw in, ubiquinol in there. But if you're severely deficient and you're having, problems with the electron transport chain in general and your cells, then it might really affect you. You might get some severe muscle cramps or fatigue or things that, So, it's not really, it's just not talked about. There's just protocols that fit this model. And there's not a lot, unfortunately, of critical thinking, especially when most PAs have to see, 5, 6 patients an hour. I mean, it's kind of out of control. You walk in there and it's unfortunately in my experience, because I've been doing this 17 years, it's been getting
Mhm.
worse. Um,
Yeah.
you used to be able to, kind of take your time and you could bill for a few things, but now everything's like maximize the billing. Hurry, you got 5 minutes to be in there and you got a chart and this and that. And now the kind of the standard of care is to have a medical assistant follow you around and chart for you, because you need to be able to see more patients to be more profitable. And so it's just this rat race. And most clinicians I know are really tired. They're really burned out. They're like I said, I think they have good intentions, but the system that they're operating in now it's very difficult to be heart first, to really care,
Mhm.
because they don't have enough time. Their hands are tied what they can do. There's too much peer pressure. And there's not enough knowledge. I mean, no one knows any. I mean, most clinicians, pediatricians today still say, well, there's not enough evidence about autism. There's not enough evidence. We
Yeah.
don't have any
People say
clinical,
that.
we don't have any clinical trials, and we just don't know what it is. And it's just, unfortunately, that's just ignorance. It's not true. And that's and I don't blame them, because they're so busy. I mean, this is why it's nice to have a niche. This is why it has a specialty. Like, we are a pediatric special needs. I mean, we do treat ADHD and OCD and pandas, other kind of comorbidities, but it's primarily autism in the practice. And I will note too that another great thing that we do, that I like what we do, is that we look at the mothers too. So I do
Huh.
preconception care as well,
Yeah,
because
yeah, yeah.
a lot of this stuff is like, well, we've found that the moms have a lot of these issues to begin
Yeah.
with. And so we'll do an evaluation if a mom's looking to get pregnant again, like what happened, what did you do during your pregnancy? Okay, let's not do that again. And how can we optimize your metabolic health now? She probably needs extra methylfolate. Like, that's a great thing. Vitamin D, we probably should put her on some extra. We have kind of a whole protocol, or just kind of general guidelines, but we'll look at these things that we often look at with kids on the spectrum, and we find that they're frequently abnormal. Thyroid is a very common one too.
Yeah, tyrosine.
Oh no,
Tyrosine.
not thyroid hormone.
Yeah, but the synthesizing from tyrosine
Yes.
is an aromatic amino acid, and it requires 200 to 400 nanometer light to activate.
Yeah.
And this is like I'm glad you mentioned the mother, because the environment of the pregnant mother has changed so much over the last 50 to 100 years.
Yeah.
It's just like, okay,
Yeah.
we need to be aware of that.
Yeah. Yeah, it's very unfortunate. I mean, there's a lot of maternal studies that's saying that that air pollution, so 2.5 parts per million air pollution exposure increases your risk of autism, and during pregnancy. Maternal SSRI use, antidepressant use, increases the risk of autism. Like I said, hypothyroid, PCOS, vitamin D deficiency,
Mm-hmm.
Zinc deficiency. There's a lot of things we can look at that correlate with the maternal health. And, and that's kind of why, just to kind of full circle about, these like vaccines, for example, maybe being a part of it, but maybe not being the whole part, is I've had several families. Like, I had a family that they had a child with autism, the mother, and then she vaccinated him, and she swore it was the vaccines, which, I believe her. I mean, I never tell patients no. When they tell me, like, this is what I think it is, I say, okay, let's investigate that. I mean, it's not my, I want to look at other things as well, but I believe people, as it were. And so we look at that, and I say, okay, and we talk about it, and she kind of disappears for a while. I hadn't seen the kid, and then she comes back a couple years later, and she's like, oh, I had another kid, and we didn't vaccinate him at all. Not one vaccine for this child, and he has autism. And so she was really upset, because she swore that was the only thing. And I think, I kind of tried to convince her, that hey, let's do some maternal testing as well. If you want to have another child, let's look at you. And I hate to say that to mothers. As a mother, like, with 3 kids, parents get so upset, and I'm not blaming the moms, because gosh, I had my own time of blaming myself, and what did I do? And I shouldn't have taken that Tylenol, or I shouldn't have done,
Mm-hmm.
we have all these woulda, shoulda, coulda moments,
Oh, sure.
but it's the mothers love, these mothers love their babies. I believe that, and it's nobody's fault. And I think, we need to look at everybody's health. Maternal health is very important.
Mhm.
And by the way, sorry to keep expanding, but also paternal health is important.
Yeah,
So
yeah, yeah.
the age of the father, increasing age, actually increases a risk of autism as well.
Mhm.
So father's health matters too.
Yeah, absolutely. Yeah. It's so good. Uh,
I know I'm throwing a lot of truth bombs at you.
no,
Sorry.
it's just like it's like you're preaching to the preacher now, you know?
Yeah.
It's like
Yeah, it's
it's
great.
like, oh my goodness. I have an episode on autism research and a proposal for research.
Uh-huh.
And it's just I think it could do something. And I don't know. There's a lot to the light story and how humans use light because of that electromagnetic field, both the sunlight and artificial light. There's
Yep.
electrons and magnetism attached to it.
Yep.
And everything with mitochondria is the electron transport chain, and it's a lot of magnetism with the iron sulfur clusters
Yep.
and that spinning FO head that's producing out the ATP. A
Yep.
lot of magnetism there. And that's why like iron is so important for hemoglobin.
Yep.
It's all magnetic.
Yes.
But I mean, it's tough for people to comprehend that because they don't care to know that.
Well, I think a lot of it, and I can't speak for you, but I know that I'm very much in this world. And so I think that some people with autism, not all, of course, but have like a sixth sense. So I've always been really sensitive to fluorescent lights and a lot of these LED lights. And it really is neurostimulating for me. I have a very hard time, like in certain lighting situations. Um, and I also have, I have had periods in my life where I've had a hard time with EMF as well. There were points in my life where I could tell I was next to a router, and I turn off my Wi-Fi every night. And
Oh,
I
do
can,
you? Good.
yeah, oh yeah. And I absolutely, I mean, I feel like at points, not always, but I can feel these things. And I feel like my son can feel them as well. Like my kids, they're very sensitive, and I'm very aware of how important the sunlight is. This is why I'm like still kind of tan, because I make our
Mhm.
kids go outside. I'm like, we're gonna
Mhm.
go outside, and they go no, because of the screens. But I make sure my kids are tan. We get at least an hour or two of sunlight a day. It's very important to me, and I think that it is a baseline of health. I mean, in addition to vitamin D that it's producing, there's a whole cascade of antimicrobials and anti-inflammatories that the sunlight. I mean, I think you're on to something. We're meant to be in the sun. I mean, we're not meant to be in a box and
Yeah.
made of chemicals and fluorescent lights. And so, yeah, I'd be interested to hear what you have to say on a paper or looking that up. I mean, I absolutely believe that there's a lot of forces, of course, we know we can't see and that are affecting us super directly. I mean, that's
Yeah.
that's not voodoo science. That's real
Yeah.
science.
That's a lot of people don't know about the different wavelengths in light. Like
Mhm.
light has wavelengths,
Uh-huh.
and how our human biology takes those wavelengths, what they do with those wavelengths,
Yeah.
and that's missing.
Yeah.
Something you mentioned earlier
Uh-huh.
about tailoring to each um, individual or
Yeah.
client, patient, child is the. Can you talk a little bit about the comprehensive evaluation process?
Yeah, and I will absolutely, and I have a whole nother talk that I've given a presentation on this through Taka, which is it's like takanow.org. But anyway, if you it's an hour long, and it talks about my comprehensive evaluation and what it includes, and it goes into in detail. Obviously, we don't have an hour now, but it is posted on my X profile under Nicole at Nicole Rincon. It's also posted on my website, which is www.nicolerincon.com. But to just start out, when I see a patient, the first thing that I personally look at is how is their detox functioning? Because when you throw in a bunch of novel interventions to these kids, a lot of times, unfortunately, we see that there are a lot of toxicities, either metals or molds or pesticides or things that there's an issue. And so I first evaluate how is their constipation, or how is their bowel movements, because a lot of these kids are constipated, and I find that that's really a key factor. So we will make sure, because to back up, the 4 ways your body really eliminates, actually excretes toxins is feces, so bowel movements, urine, sweat, and exhalation, so breathing. And so we need to make sure these are being optimized. If you're not urinating, drinking enough, not urinating enough, you're going to have a problem with any kind of protocols that we implement, because a lot of things that we're going to be doing are stimulating your body's response to improve. And oftentimes, if the detox pathways aren't optimal, then the kids are not going to have a good response. They're going to say, oh my gosh, Nicole, you made me worse. And they're going to leave and they're not going to be happy. And, we just pushed them too hard, too quick. So basically making sure that they're having at least 1 to 2 daily bowel movements. I really like oxy powder. It's like an ozonated magnesium to help stimulate the bowels. In kids that are constipated, which most of them are, I find, making sure they're drinking good quality water and frequently. So I'm a big fan of reverse osmosis water.
Mm-hmm.
We have one in our house. I think that they're a great alternative to certainly, not drinking tap water.
Yeah, with the fluoride.
But also, there's a website called, what is it? I think it's EWS. But it evaluates, the water in your public water system, the chemicals. So, you can look, and mine has a ton of arsenic, and it's got, nitrates and nitrites and chromium way above the upper limit. And it's got even uranium. This is like stuff that we're drinking, and you're showering with. Anyway, so getting an RO, I even put, in all my shower heads, I always put at least a carbon filter over my shower heads to kind of get rid of some of the chlorine. And, making sure that they're getting enough sweat. So they're exercising, ideally out in the sunlight. And then they're exhaling. So part of that is the exercise. So, basically optimizing those functions first before I do anything. But then typically I will get some basic blood work. And I don't want to go into like every single test because, like I said, that's an hour long. But a lot of it is we can look at methylation, like MTHFR genes. I look at, basic stuff like anemias, iron levels, liver function, kidney function. We're looking at plasma amino acids, and we're looking for mitochondrial markers. Sometimes we'll get a lactic acid for that. We'll look at alanine lysine ratio. You can get a CoQ10 level. We'll look at carnitine. You can look at both acyl carnitines and total free carnitine, again, which is a whole nother discussion, but carnitine levels are frequently low and easily treated. We'll look at, vitamin D, some immune function. Some kids that are always sick, I get an IgG subclass, IgA, which looks at kind of gut immune function. Is it low? Is it high? Do you have SIBO or lack of diversity? So there's a ton we can do, just even on blood work. That's typically covered by insurance, which is really nice. Not always, but usually. And then I'll get did I mention zinc? Zinc's super important too. I love testing for RBC zinc. And magnesium for minerals. And then we'll get a stool analysis. So a lot of these kids have fungal overgrowth, either in their upper intestine, lower intestine, both. A lot of gram-negative bacteria. So you see a kid with a lot of inflammation. I'm thinking, okay, probably gram-negative bacteria in the colon that creates that LPS production, lipopolysaccharides. So a lot of times we'll see kids with a lot of Proteus mirabilis or Klebsiella or Citrobacter, these crazy, really kind of toxic bacteria. So we can treat that. We see in the stool analysis, you can see if they're underproducing digestive enzymes or if they just have like frank inflammatory bowel, like indicated of like Crohn's disease, celiac disease, things like that. I see sometimes. We'll do what's called a urine organic acid test, where it looks for metabolites in the urine of certain bacteria and of mitochondrial function byproducts. And so this is oftentimes how you can find C. diff, because Clostridia difficile won't culture necessarily on a stool test because it's an anaerobic bacteria. And when you're introducing it to stool, it's an aerobic environment. So it won't grow on an aerobic culture. And you think, oh, they don't have it, but they're just not testing for it the right way. So you have to get an organic acid test to rule out C. diff. And, then you treat that, so Like I said, there's a lot of, in that organic acid test, you could look for mold metabolites. If they have a ton of these fungal markers that are maybe aspergillus markers, fusarium markers, candida markers, and you go, okay, they've got some serious fungus on board. And then what else will I usually get? I'll usually try and convince them to get an overnight EEG. That one's a little hard, but because the kids have to wear a cap and they have to sleep on it. There are some outpatient services that are really good that can do that for the kid, and they can do it in the comfort of their own home or at a hotel instead of going into the hospital. Because looking for seizures is important, and treating seizures can actually help the behaviors as well and the functioning of the brain, decreasing inflammation, certainly. The other thing that I love, that I always test for on the blood, is the folate receptor antibody test. Like I mentioned earlier, that's a private test. You have to send to a private lab, so insurance won't cover it. But those are crucial. Like I said, up to 80% of kids have high folate receptor antibodies, and they found that the higher the levels, the more severe autism symptoms generally are, and then also the better they respond to leucovorin, which is it's just a prescription folinic acid, high dose folate, essentially. So higher the titers, more sick, but they also respond better to leucovorin. So I've seen some super huge gains with just that treatment alone.
Wow.
Yeah, I mean it's really good stuff. Like it's just as far as one like kind of a one size fits all, and as far as parent rating scales and the double blind placebo studies back this up. I mean the literature is across the board positive, and it has very little side effects. I mean it's very well tolerated, and anything you don't need you urinate out. So it's kind of it's kind of incredible. That's been my kind of one of my favorite treatments because it just seems to be effective. And what else do we measure? We can do other things. We can look more specifically into mitochondrial dysfunction, like a mito swab. It looks at the electron transport chain, kind of complex functioning. Looks at like complex 1, complex 3, citrate synthase. But, a lot, again, when you see a new patient, you want to look at, does this kid look like mito? Because if he has really low muscle tone, really poor growth, you're thinking maybe it's mito dysfunction. But if he's just sick all the time, we're thinking maybe you're immune, or maybe the parents are like, his stool is just awful and it's been awful, and like we can't seem to get it anywhere near awful, and so you kind of guide what we need to target first, because based on like what are their most severe symptomology, and and we take it stepwise.
Yeah. So you're approaching this from a different perspective from somebody like in a ABA or mental health or a psychological assessment type thing, where they don't really get answers. They just get an answer of diagnosis yes or diagnosis no.
Yeah. Okay. And I mean, to be fair, I mean, I was talking to Dr. Fry about this not too long ago, and he's like, Nicole, what the best treatment is? And it's like, what? Okay, give me this truth bomb. He's like, oh, it's the kitchen sink approach. It's like there was a study that, kids that basically did all the interventions for the longest period of time had the best recovery. So, and I do believe that. As far as ABA, some parents say it's cruel because the kids are, if they don't like it, or they're, not high functioning and they're not getting it, it can be very upsetting, and it's probably not the right treatment if you're feeling that way about it. But the studies do show that it helps in general. It does help functioning. I mean, the scores are there as far as controlled trials that it can help. So, what I tell parents is just try everything, do everything, do the exercise therapy, which can be shown to be good. Do the probiotics, do the ABA or the OT, put them in early school, get them in socialization groups, do the floor time, and, come see me. Let's talk about your diet. We got to change your diet, your water, your exercise, let's try some meds if we're not getting there. And so you just kind of do this, multifactorial approach. And then, if it's not fitting, if something's not fitting, take it out. And, it seems to, unfortunately or fortunately, be dependent a lot on kind of the amount of effort you put into it. If you're just like, we tried a couple supplements, it didn't do anything, or, and then some kids that don't, not all kids make all the gains that other kids do, but, and I understand, I mean, these parents are really tired and they're very exhausted, and it's very financially consuming sometimes. And,
I think
yes.
these things are an alternative, though, that could give them hope and
Yes.
provide answers. At least get them off of the standardized path
Yes.
that is very inconsistent,
Yes.
and provide them with something else,
Yes.
a different alternative. And
Yes.
I just can't get over, like we mentioned earlier, about going upstream and investigating all these biological processes.
Yeah.
This is so fascinating
It's really fun. I'm here to tell you.
yeah,
I really enjoy it.
because this is where it's at.
Yeah.
This is
Yeah.
where the autistic phenotype starts,
Yes.
and all of those comorbids.
And it's the future of medicine. It really is.
Yeah,
It's
yeah,
the
it
paper.
should be.
It's the way people want to be treated. Like want to be medically treated. And it's the way that it's appropriate, and it's certainly the way that worked for my family. And
Yeah,
we focus on autism in our clinic, but yeah, I mean, there's so many other metabolic diseases that could be treated very similarly the way we do this. Between diabetes and, like you said, Alzheimer's and just a slew of thyroid disease and things like that. I mean, a lot of this goes back to the functional medicine, the functioning of the cells,
yeah,
and how they all integrate with the systems. And I'm so excited for the future. I really think, like, all this literature we mentioned earlier when we were talking about, on the media now, with RFK Jr., and he's bringing up that we need to clean up the food, and and I'm so excited to hear that, because I've been saying that for a decade. It was just like, a lot of this is a disease of environmental toxicity, unfortunately.
hmm
And yes, there's finally movement, and people are talking about
yeah,
it, and people are looking at their water, and they're looking at their food, and they're thinking about maybe taking a few supplements to help optimize, whatever, maybe MTHFR deficits they have, or other
hmm
genetics, or just whatnot, just, whatever lifestyles that they're living that they need to help, kind of accommodate. So it's a really, really, really cool time to be practicing medicine.
yeah.
It's like
Agree.
I'm super excited about it.
It's becoming in people's radar, and it's obviously a lot of our health trends are not trending in a good direction, and people want to know why. And yeah, there's a lot of hope coming around the corner, I
Yes.
think.
Yes.
So with everything, and some of the things that you introduced here, we'll do more episodes and talk more in depth about some of these, and even maybe introduce some new items so people know about this.
Yeah.
People needs to know about this.
Yeah. Yeah, absolutely. Yeah. I mean, like I said, there's, I have my clinical practice and kind of see what works and what doesn't. And I also, I really focus on a lot on the research, and I know the Rosignol and Fry, so we're trying to blend, how does this functionally land on the patient? How is this actually working out? How do we read some study on paper and then actually implement this treatment? And then how are we seeing that this is working out? And then sometimes I don't, sometimes I'm like, I didn't see that correlated too much in my own view, or sometimes it's really great. So, yeah, it's an exciting time. I like that we're looking at the literature and kind of making it more scientific again, like we talked about. I mean, not everything is a trial. Not everything has to be trialed.
Yeah,
Sometimes you just have to go for it. On the other hand, I mean, sometimes you just have to base it on clinical suspicion. The parent's like, what I noticed, when he eats garlic, he feels better. And okay, and so you just, sometimes you just go for it, but based on parent ratings. But yeah, it's a very cool model that I think we're going to see a lot more of it in the future. I think a lot of people are going to be starting to practice medicine this way. And I think that, and like I said, I think that a lot of practitioners want this too. I think that a lot of PAs, and, to be biased, but I think a lot of people are going to jump on board, once it becomes more mainstream. I think this is what,
yeah.
Frank, I don't blame the doctors and the PAs for the system.
Right. It's
Most
the
of them,
paradigm.
I think, are good people, and
Yeah.
this is just where the model they fit in, and they have families, they have medical debt, they're trying. And I know there's some bad stories, and there are, but I see a lot of them that are leading heart first. I have some of my best friends are PAs, and they're just, man, Nicole, they're really trying, and tell me about their patients, and they care. They really
Yeah,
care.
that's what got them into healthcare.
Yes, yeah. Like I very rarely see, like some people are jaded in any career, but I think that things will turn around, and I think that most people will get on board.
Yeah. Sometimes the trial has already been proven to us. We don't need a randomized control trial through Mother Nature.
Yeah.
And everything that, like you're testing, well, Mother Nature gave us through evolution.
Yeah.
Many generations of evolution. So
Right.
just get it back to that.
Yes.
So,
It's often about less, not more.
Yeah.
Right.
Thank you for sharing today. And we'll put together some items for future episodes for sure.
Okay. Well, thanks, Ryan. Thanks for having me on.
You.
And again, for viewers, like I said, I have a website, and I have my Twitter page, and I am also still seeing new patients for now at Rosignol Medical Center. We're out of Orange County, so in California. So let me know if you guys need any help. But I look forward to making more podcasts with you. This is fun. It's really fun.
Yeah. I'll put all your information in the show notes, and definitely promote the clinic and your work for sure.
Yeah, we got 3 trials coming out too, so be on the look. I'm going to share those on my profile. So one's pretty quick, and we got 2 more. So hopefully by the end of the year, I don't know, it's kind of pushing it, but we'll hopefully get them out. We'll see.
Yeah, maybe you can give us some teasers. Maybe you can give us some teasers from it.
Most of them are, 2 of them are review trials. So we're trying to do, like I said, we're actually reviewing all medications affiliated with autism in that are randomized control trials. And so what is the entire body of evidence? So these pages are like 100 pages long paper. So it's a lot, but just, what are the medications that help? Why? What symptoms are they helping, which don't help, which have the highest side effects, which don't, and we're doing the same thing for another paper for supplements. So what is the most, that's how I kind of know about these supplements. And so just to give us as clinicians a map of like, this is pretty decent quality evidence, and this is what you can try to use, because we even get specific. A lot of the trials are specific with dosing, so you can not just guess at where to start. And then, it'll also give, like I said, the clinicians a start, but also the patients too. If you're like, hey, I was thinking about omega, and I read this trial, and okay, like this looks good. And I don't encourage people to like practice medicine, without a doctor, but I know what happens, and I want to encourage people to do something, I don't want people to freeze. Some of this stuff, don't go buy random medications in Mexico that, or, from India that you don't know what you're implementing. That's pretty dangerous. But, some of these things are over the counter for a reason. Fish oil is pretty safe,
Yeah.
Most of the stuff, that you can buy is pretty safe.
You're giving them informed consent. That way they are fully informed to make a decision.
Yes. Yeah. And yes, exactly. So, I want people to feel empowered, to, not feel, just feel hope. Like, well, let's try it, or whatever, you know that there is evidence out there. We're not just, this is not snake oil, I mean, really, and it's true, and we're not profiting. I mean, we're not profiting, this is just, we're just putting this knowledge out there. I mean, when we publish trials, they've always been open source, free, they're not behind a paid wall. So, because I work with good guys, they believe in this stuff. So
and there's a lot of passion. And Dr. Fry, whenever he was on, he was just so interested in just sharing the information and even teaching me and just coming on and spreading all this knowledge. Yeah. So, well, thank you, and looking forward to the next ones.
All right, Ryan. Thanks. Me too.
Yeah. If you're listening to the podcast or listening to the episode, please feel free to leave a review or ratings. In podcasting, review and ratings are crucial, and I very much appreciate your feedback. You can contact me on X at RPS47586, or click on the hop link so you can have links to all the show platforms and contact information. You can email me info.fromthespectrum@gmail.com. And thank you for listening. to From the Spectrum podcast.